Bismillahirrahmanirrahim. Thank you, Abbas. Bahut shukriya. Thank you. And Honorable DG, Dr. Niaz Mohammed Saab, Public Health in charge, Dr. Ikramullah Saab, DHIS Provincial in charge, Dr. Abid, and all DHOs and DHIS district coordinators from the three provinces. Thank you so much for taking time. Of course, Abbas Saab and the entire team sitting here with you. Thank you so much for taking time, sir. For me, DSAB, this is, and of course, Ayub Rose Sab. Ayub Rose Sab has support. I'll take this opportunity, sir. Niaz Sab, I think this is a historic moment. And why I'm saying this is a historic moment, I mean, we have been hearing about health service delivery package for decades, actually, in Pakistan. It was developed for health services, primary and secondary health services for the last more than 2 decades. But we never had this idea as to how this supply chain package can be translated for the requirements of district needs and below district, actually, for basic health units, THQ, DHQ, and primary and secondary health, the entire health system there. Yeah. And KP government is the first government. I mean, we have been working on this, supply chain, as you know, sir, for the last at least now 10 years under USAID support, Gates Foundation, and Gavi support. And we have been working with you in many ways on the supply chain fronts. But development of this supply chain package in the form of these 6 guidelines for district level as a supply chain service delivery package is something for the very first time in Pakistan. So I would really like to congratulate you, your team. Your team has been working with my team. We have been consulting, and we have been actually developing these, packages for the for districts. But hopefully, this will be applied to the entire province. But I think AP government has actually set a great example for other provinces that along with the service delivery packages, supply chain service delivery package is essential in terms of not only quantifying the requirements in the form of, for example, so this 5 years forecast document that has been developed in consultation with the district governments for these 4 districts. I'm very happy that we are actually working very objectively with your teams moving forward on not only quantifying the requirements, but also looking at how we apply the art and sciences of supply chain, at the district level at DHU, THQ, RSC, and DHQ. And for that matter, I'm also very thankful to you, sir, and your team members, especially the 4 districts who have been actually consulting, on a very regular basis. Is basically the development of those posters, which will be mounted in each facility as to see how we apply जो sciences हैं, storage, distribution, transportation, forecasting, information system usage, ये जो 6 packages हैं, how to use that at the district and sub-district. This is a great development, sir, and I'm sure we would like to take this opportunity to blow our trumpets, not only, of course, sitting here and congratulating you, but also taking this important development with other provinces of Pakistan. I've already spoken with Dr. Faisal and Dr. Amir at the national level that how KP government is actually looking at the supply chain packages, which is the backbone of the primary and secondary healthcare. So my humble submissions would be, now that we have developed this package and the forecast for 5 years, the forecast for the next 1 year is about more than 300 million rupees for these 4 provinces. Charsada is about 35 million, Sawat is 221 million, Zaki Marwat is about 34, and Momand is about 11 million rupees. And these are all basic health products which have been forecasted for the next 5 years. My humble submission would be starting from this, if the financing can be allocated to make sure that primary and secondary healthcare medicines, which have been actually quantified by your team members in these 4 districts, should be available at the dispense of the district coordinators. Number 2, my humble submission would be, sir, inventory management module has been developed. And honestly speaking, sir, this is actually this automation of primary and secondary healthcare system in these 3 districts has actually given us the opportunity of actually monitoring all those medicines which are automated in terms of inventory management and reporting LMIS module. So I think many people have been trained, sir, from the three districts, and automation has been done. Reporting is regular. So I would request and urge that not only the implementation of packages, these packages should be monitored very closely, but also जो इन्वेंटरी मैनेजमेंट मॉड्यूल है सर जो हमने डेवलप कर लिया है और माशाल्लाह तीनों चारों डिस्ट्रिक्ट्स में लोग ट्रेंड हैं वो इस इन्वेंटरी मैनेजमेंट मॉड्यूल को जो है वो अच्छे तरीके से यूज कर I think this will be a great moving forward development actually. As far as other aspects of supply chain technical assistance are concerned, I'm very thankful to you, both Special Secretaries and Secretary Sahab. We had a great meeting with Taimur Jhagra Sahab. Taimur Jhagra Sahab is our great support from the times he has been working in McKinsey. He's a great leader of supply chain management and sciences for integration into public sector dimensions. सर हमने कोई एक महीना पहले उनसे मुलाकात की, उसके भी मिनट्स आई नो अप्रूव हो चुके हैं. वी आर वेरी थैंकफुल सर कि not only the political commitment from KP government, but your commitment, especially in the form of developing very state-of-the-art and new tools for the district government in the form of supply chain packages, is something a very meaningful development actually. I know, sir, there are challenges in terms of domestic financing. Pakistan is facing problems, and I know some of the resources have been actually diverted in Department of Health, for example, on contraceptive procurement to other areas of importance. But my humble submission would be, sir, the public health policy cannot be connected with people of Khyber Pakhtunkhwa until and unless the products of basic health services, maternal health, child health, family planning, all primary and secondary health care products, if they are not available in the hands of the people from the primary and secondary care system of Khyber Pakhtunkhwa, we may not be able to connect the public policy of Khyber Pakhtunkhwa to people of Khyber Pakhtunkhwa. So that remains very important in terms of not only connecting domestic financing from Khyber Pakhtunkhwa to the people. We will be, sir, walking and talking and shouldering with you on many other aspects, and I will not go in detail, but we are working on hepatitis C elimination program with you. Dr. Ayub is here. Your team has been helping us a lot. We are working with you on basic health services, maternal and child health services, on infectious health, infectious diseases, especially on national security agenda. And I'm sure, we will go a long way with your leadership, with your teams, teamwork moving forward and implementing these packages, in the 3 districts and taking this to the entire spectrum of the province. So once again, sir, I'll just stop here, thanking you for your leadership and your team's leadership in making sure that we can actually present the packages today with your presence. Thank you very much, sir. Thank you.